at the NSIA-LUTH Cancer Center. My first message goes to the parents. I understand there's been stigmatization surrounding childhood cancer, as many people believe that childhood cancer is not curable and usually it's a death sentence. But there have been studies carried out all over the world that proves otherwise. For childhood cancer, early detection is very, very crucial. And what do I mean by early detection? When most children are bubbly, they're happy, and when you see a child, they just have this sweet air around them. So when you notice a usually happy child is not as playful as he or she used to be, is sleeping a lot, or you notice this child is just not well and this has been persistent for a while. So that's a cue to take the child to a health facility for the child to get evaluated and be reviewed. And why is this important? Studies have proven that when a child presents to the hospital early, treatment commences early, and this helps to improve the prognosis. What do I mean by prognosis? The outcome of the disease. For most children that present to the hospital early, there's an increased chance of cure. And in high-income countries like the US, Europe, studies have proven that they have 80% cure rates. So although we are not at par with them, but even for children here, I have seen countless children that present to our facility, and after being treated, they get well because the parents took the cue and they presented to the hospital early. I see parents with their children recently diagnosed, and the mothers are confused, oftentimes shattered on, was it something they did while they were pregnant with the child? Was it something they ate? Was it some place they went to? Was it something they didn't do that caused the child to having this cancer? So I would like to state that half the time, or 80% of the time, it's not something you can help. It's not the mother's fault. It's not something she didn't do or something she failed to do. Sometimes it just happens. I also try to relieve her of the guilt, because they come in with this bag of guilt, and it further dampens the spirit and it affects the child's care. And I would state now that it's not the mother's fault, it's not the father's fault. Sometimes these things happen and you just can't help it. And there's a small percentage of it being a hereditary factor, which is one of the predisposing factors. But however, it's not the mother's fault and it's not something she didn't do right. This month is dedicated to create more awareness so parents and caregivers can know that childhood cancer diagnosis is not a death sentence. Once you notice your child is not sleeping well, or is sleeping too much, or the teachers are complaining from school that a normal, healthy, playful child with good grades, all of a sudden grades have dropped, and the child is sleeping so much in school, or the child is just not behaving like the child will normally do, that's a cue to take the child to a specialist for them to be evaluated and reviewed. Finally, childhood cancer is not a death sentence. It is very, very important that this condition is detected early, and it's also important that the parents present to a healthcare facility and get appropriately referred, as this has been proven to increase the chances of survival. Keep spreading the word. Once you watch this video, share with your neighbors, share with everyone, so everyone can know that once a child is diagnosed, it's not the end of the world. It is an actual terrible disease.